Hi, my name is Karissa, and I am a nurse practitioner student with Azusa Pacific, and today I am going to be completing my newborn physical exam. So first, we will start off with talking about the prenatal care of mom's pregnancy. So she did inform me that she did take all of her prenatal vitamins. She did follow doctor's orders regarding her prenatal care, and she did follow up on all of her appointments as necessary. As far as the delivery, baby is about a week old today. She was born through spontaneous delivery at about 39 weeks and 4 days old. Mom reports there was no complications with the delivery, and there's no complications with baby during birth as well. As far as baby's feeding, baby is breastfed and is eating about 3 ounces of breast milk 3 to 4 hours a day. Baby has normal bowel movements, yellowish stools about twice a day, and baby is having about 10 normal wet diapers a day. So next, we will start my physical exam. Today's baby's vitals temperature is 98.7 rectally. Baby's heart rate is about 140 beats per minute. Baby is saturating 100% on room air, as well as her respirations are about 40 respirations per minute. So we'll start by looking at baby. Baby has looking at her general appearance. Baby looks happy, calm. It does not look like they're in distress or any pain. Baby's skin looks appropriate and appropriate for their ethnicity. I don't see any obvious rashes or lesions as I'm looking at baby right now. Tone looks okay, looks flat, not rigid. Baby seems to be consolable if baby does end up crying. Here, I would take a look at baby's umbilical cord, making sure that it's dry. I'm educating mom that umbilical cord will fall off on its own. Please do not try to pull it off. We want to keep that area clean and dry, and making sure when we are putting on baby's diapers, we're keeping the diaper flap below baby's umbilical so it does not accidentally pull it out. We're going to start the head to toe assessment. So first, we will measure baby. So we're going to measure baby from head to toe in centimeters. Baby is about 26 centimeters. We're also going to measure baby's head circumference. Which is about 24 centimeters. We will first start looking at baby's mouth. I will stick one finger in baby's mouth to assess for palate. I'll stick it in here, rub against the roof of baby's mouth to make sure there is no cleft palate. While I'm here, also I will assess baby's sucking and make sure that baby's tongue has no lesions, is symmetrical, and it feels okay. Here, I'll also look at baby's lips. Make sure there's no discoloration on the lips. There are no lesions. They are patent and they are symmetrical. As well, while we're here, we will look at baby's ears. They look symmetrical, no redness. There doesn't appear to be any drainage. So at this time, I would also look into baby's ears with the otoscope. So we'll look on both sides of baby's ears. We'll move on to the eyes. It doesn't seem to be that there is any redness, any discharge, any discoloration of baby eyes. It does not appear to be jaundiced. While I'm here, I would also check baby's red light reflex with the ophthalmoscope. Okay, and then we will check baby's head. So we're going to check both the anterior and the posterior fontanelles. So we're going to set baby up. We'll check the anterior fontanelle, anterior fontanelle. Making sure that it's flat, informing parents that the fontanelle will close at about 9 to 18 months. We'll be checking the posterior fontanelle while we're here, making sure that feels okay, informing parents that it will close within the first few weeks of life. Making sure baby's head is symmetrical. There's no obvious deformities to baby's head. Next, we will assess cardiac. So just by generally looking at baby is chest looks okay, it's symmetrical, there's no obvious labored breathing or distress noted. I will take a listen with my diaphragm. And while I do this, I'm making sure to listen to the point of maximal impulse for a full minute. While I'm here, I will also assess baby's stomach, making sure it looks okay. Again, the umbilical cord looks clean, dry. I'll also take a listen. Listening. And her bowels sound okay. And then I will turn baby over to listen to lung sounds. Now while I have baby here on her stomach, I will assess her back, making sure there's no skin discoloration to her back. She has no rashes or lesions. We'll turn baby back over. And then we will now assess her genital area. So we'll remove the diaper. So she's a female. We will make sure that her vaginal area looks okay, that it's clean and dry. There's no moist. There is no redness. There's no discharge. And I educate mom and dad on when they are changing their baby's diaper to make sure they are cleaning her from front to back to prevent any infections. Next, we will assess her hip displacements. First would be the barless test, where we will start with baby's knees out. And then we will bring them down into the center. Informing mom and dad that if there is a pop that is abnormal, but since baby has no pop, she is okay. As well as the Ortolani test. We will bring these up. And then out and down. Again, same thing. If she has no pop, then that is a normal test. We will assess her extremities, testing her arms and her legs just to make sure she has even tone. They are not rigid. Her finger and toes, all 10 toes look okay, and all fingers look okay. Assessing her reflexes. The first is rooting. We will stroke one corner of her mouth. So I will stroke left corner of her mouth, and we will expect baby to turn her head to the side of the stroke. So I'm stroking corner of left mouth and expecting baby to turn to that side as well. Sucking, we will put one finger in baby's mouth, and we will expect baby to automatically suck on my finger for her reflex. As far as the tonic reflex, we will turn her head to one side. So I will turn baby's head to the right side, and we will expect her to stick out her opposite arm, which would be her left side. For the grasp, we will put our fingers into baby's hands and expect baby to grasp our hands for this reflex. The stepping reflex, we will hold baby up, putting feet on the ground, onto the bed, and baby should curl up, assessing her stepping reflex. And her Babinski reflex, we will take one foot with our finger, roll our hands down, and her toes should curl up. That completes my physical assessment. Next, we will talk about the plan of care and anticipatory guidance. So mom is planning to follow up with baby at her 1 month appointment. As far as anticipatory guidance, mom and dad were educated on proper use of car seat, making sure that the car seat is rear facing, making sure baby is completely strapped in, as well as the car seat is strapped into the car properly. Also educated on bath, making sure the temperature of baby's bath is not either not too hot or too cold, and just at the right temperature. And lastly, they are educated on their sleep, educating parents that baby should sleep in a crib flat on its back with no blankets or pillows inside of the crib. Lastly, we'll talk about immunizations. Baby did get her first dose of Hep B in the hospital when she was born, her vitamin K injection, and her erythromycin ointment. At around 2 months, she would get her second dose of Hep B, her rotavirus, her poliovirus, her DTaP, her pneumococcal, and her HIV. And that completes my assessment. Thank you.